exercise is passive ankle stretch. Here the idea is to stretch the ankle joint so that the flexibility of the muscle improves and the person is able to do the movements easily. Do passive ankle stretch for 10 repetitions. Friends, even though in this video I am showing this exercises over kids, but these exercises can easily and can be equally performed by adults as well who are having problem of foot drop. Be it stroke, be it Parkinson's disease, these exercises can be used to improve foot drop. The second exercise is passive foot eversion and inversion, which means you need to rotate the foot first inward and then outward. Make sure that the knee is absolutely relaxed by slightly bending it so that the eversion and inversion movement can be done easily. The next exercise is active assisted toe raise, which means not only you are giving support to raise the toe, but you are also asking the patient or the child to raise the toe himself or herself. All you are going to do here is you are going to give a guiding support to which direction the child needs to move the toes. That's all you are going to do. Rest entire effort should be given by the child. For the next exercise, make sure that the child is sitting in 90-90 position, which means the knee is bent at 90 degree, and then encourage doing active assisted toe raise, which means here you are giving the advice or else the command to raise the toes for the child, and you are giving a guiding command and guiding push upwards, which will allow the child to raise the toe. Later on, you will encourage the child or the patient to do the same movement actively. For that, you need to place a finger above the toes and then encourage the child to raise the toe. You can do this for 15 to 20 repetitions, but if you feel more repetitions are required, feel free to do that. For this exercise, place one foot over another foot and then encourage the lower foot to raise upward. Here, the support is given by the foot which is below the top foot, and this encourages bilateral activity. If child is not able to perform, still demonstrate and encourage the child to do it. Next exercise is active leg raise, for which you need to keep a finger or else give a target to the child and then encourage the child or the patient to raise the leg and try to touch to your hand. You can do this for 10 to 15 repetitions, but if you feel more repetitions are required or less repetitions are required, you can adjust it accordingly. And by any chance, if this happens that the child or his patient is suddenly placing the leg or falling the leg down, then you can give some support at the heel and allow the patient to learn the task of bringing the leg back slowly. The next exercise is active leg internal and external rotation. For this, you need to give support to the knee and encourage the child or as the patient to swing the leg inside as well as outside. Make sure to give some support at the foot so that the movement happens in right direction. Later on, for the progression of this activity, you can remove your hand from the foot and just place it over the ankle and then encourage the patient to lift the leg inside as well as outside. This encourages stepping activity in the child. You might need to alter the repetitions basis the need. And the last movement is practicing or else encouraging the patient to stand on one leg. When the entire weight is falling on one leg, the weight also falls on heel and patient develops the ability to put some effort to stand over heels and not over toes. This might be difficult initially, but over practice, this can be improved. You need to give some extra support on the hand or else the trunk to prevent fall, which is very important. So make sure that adequate support is given to the patient while doing this activity. The entire idea is to develop some more pressure or else some more intrinsic contraction in the foot muscles.
So friends, this is how you can do exercises for foot drop. I hope you found this video helpful. If yes, make sure to like this video, share this video and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.